Hi everyone, welcome to the Carson Kids Sensory Series. Today we will be learning about sensory processing. We will be talking about what sensory processing is. Specifically, we will focus on sensory-based therapies, including modulation, remediation, and adaptation. Sensory processing is how we feel and experience the world around us. The world is constantly sending us a lot of sensory messages, from the temperature of the room we are in, to the texture of the clothes we are wearing, how bright or dark the room is, or how noisy it is around us. Everyone receives these sensory messages differently. Essentially, sensory processing is our own individual experience of the world around us. Treatment for sensory processing disorders fall into three big categories: modulation, remediation, and adaptation. Modulation, in its most simplistic form, involves providing preferred vestibular or proprioceptive input before, during, or after necessary activities or other forms of treatment. For example, a child who is vestibular modulating may swing before working on a handwriting or sensory-based remediation activity. This child may also use a swing during or after those activities. Some other examples of modulation include the use of weighted blankets or wiggle seats. Sensory-based remediation typically involves gradual desensitization. For example, a child with an auditory sensitivity may be introduced to soft preferred sounds that gradually increase in volume. Once this is tolerated, they may then be introduced to soft, non-preferred sounds that gradually increase in volume. There is some controversy surrounding remediation for sensory processing challenges because done incorrectly, it can be a negative experience for the child. It is recommended to provide modulating activities before, during, and/or after remediation. Remediation should be gradual and based on the needs and interests of each child. For instance, a child with auditory sensitivity may have a personal goal of watching a movie in a movie theater without adaptive equipment. This would be an appropriate scenario for gradual and mindful remediation. Adaptation is often the preferred method when remediation is not necessary, but it can also be utilized during remediation efforts. Adaptation involves adapting the activity for the child's success. A child with auditory sensitivity can use earplugs or noise-canceling headphones in loud environments. A child with visual sensitivity can wear sunglasses whenever lights are overwhelming. Adaptation requires creativity and collaboration between the child and the therapist to find an appropriate and useful solution for the unique challenges the child faces. You may have also heard the term sensory integration. What we have described in this video are sensory-based interventions, not sensory integration. Sensory integration is a proven method for addressing sensory processing difficulties. It uses modulation and requires a strict regimen and adherence to its principles. If you wish to use sensory integration, it is recommended that you undergo the rigorous training before attempting to implement it. In the meantime, therapists can use sensory-based interventions at their discretion. Sensory processing is a part of everything we do. Children may have sensory processing difficulties, meaning that their experience of the world is different from our own. A child with a sensory processing difficulty may benefit from modulation, remediation, or adaptation depending on the child's unique needs. Be understanding and patient. Our next videos will help to explain sensory processing and the different senses. Thank you so much for watching. If you have questions or concerns, we would love to hear from you. As always, these videos are not a substitute for medical care. Please, always seek the advice of your medical team before implementing any of the strategies discussed here. Until next time.